I'm Dr. Gabe Schuldt, a family doctor here in the primary care clinic at Chief Andrew Isaac, and today's Medical Minute is all about what it takes to maintain a healthy heart. The heart is considered the pump of the body, pumping about 2,000 gallons of blood per day. Coronary vascular disease, or blockages in the blood vessels that supply the heart, is the #1 cause of death for both men and women in the United States. Men have a slightly higher chance of developing coronary artery disease, and the risk increases the older we get. There's nothing we can do about our genetics or age, but there are several things we can do to maintain a healthy lifestyle and reduce the risks of developing heart disease. The first thing you can do if you're a smoker is stop smoking. Smoking increases both illness and death due to heart disease. Benefits of quitting begin to appear after only a few months and reach that of a non-smoker in several years, even among older adults. Thus, for heart disease, it is never too late to quit. The second thing you can do is maintain a healthy weight. Obesity, or being overweight, is associated with multiple related health problems including hypertension, physical inactivity, high cholesterol, and diabetes. These factors definitely play a role in increasing the risk of heart disease and will be discussed separately. It's important that you eat a healthy diet. While the direct link between obesity and heart disease remains somewhat unclear, a healthy diet has been proven to have a major impact on heart health, with the following foods important in maintaining a healthy heart: fruits and vegetables, fiber including cereals, foods with low sugar and low carbohydrate content, monounsaturated fat rather than trans fatty acids or saturated fats. These include healthy oils such as olive oil and canola, avocados and almonds, cashews and peanuts. Omega-3 fatty acids from fish, plant sources, or supplements. The fourth important factor is to be physically active. Physical activity has also been shown to be very important in the prevention of heart disease. A recent study showed that coronary events are less frequent in those who exercise. Any amount of exercise has been shown to reduce the risk of having a heart attack. Even modest amounts of regular physical activity, such as brisk walking for 20 minutes daily, are associated with significant benefits on the risk of heart disease. The fifth important thing is to watch your blood pressure. Another risk factor for heart disease is hypertension, or high blood pressure. High blood pressure is a well-established risk factor for coronary artery disease, including the risk of illness and death. It is the most important risk factor for premature cardiovascular disease and is more common than cigarette smoking, high cholesterol, and diabetes, which are the other major risk factors. Hypertension is a factor for an estimated 47% of all ischemic heart disease events around the world. The sixth factor I'd like to discuss is cholesterol. High cholesterol is another important risk factor for heart disease. Multiple studies have shown the relationship between LDL, or bad cholesterol, and heart disease. We recommend that everybody with a high LDL undergo lifestyle modifications such as weight loss in overweight patients, aerobic exercise, and eating diets lower in saturated fats. Depending on multiple factors, some people will benefit from starting a cholesterol medication. Your medical provider will discuss the risks and options of medication treatment depending on your particular situation. The final factor I'd like to discuss is diabetes. Having diabetes is associated with a twofold increase in coronary artery disease. Controlling your blood sugar with lifestyle changes is the first step in getting your diabetes under control. I think it's important to work on both portion control and reducing carbohydrates to reduce blood sugar. There are also many medications used to help minimize diabetes. All these risk factors are dangerous by themselves, but when combined cause a much higher risk. Fortunately, all the risk factors we reviewed are modifiable with lifestyle changes. It's true that getting some exercise, losing some weight, and eating a healthy diet goes a long way towards leading a heart-healthy life. The other medical problems such as hypertension, diabetes, and high cholesterol can be addressed and controlled with the help of your medical provider. Thank you for watching today's Medical Minute. We hope to see you next time here at Chief Andrew Isaac Health Center.